go through. I know Megan Bell, myself, Eileen O'Connor, Nancy Purdy, Tanya Young, Janine Clifford. Did I forget anyone? Okay, Dr. Koschev, we have a quorum.
Very good. So thank you for joining the meeting. Before we really get going, we're under some time constraints and we'd like to limit everybody to about 10 minutes. So if you guys would keep that in mind, that would be great. So I'm going to start with approval of the minutes. Has everybody had a chance to look at the minutes, and are there any changes that anybody would like to make? If not, could we have a motion to approve the minutes?
I'll make a motion, James.
Do we have a second?
I'll second.
Thank you. Any opposed? Okay, so the motion is carried. Next, we'll move on to Janine. Is Janine here?
I am.
Thank you, Janine. Go ahead.
Okay, on the 7720 LB warrant, we paid WB Mason for some office supplies through the health department. We also paid Cortland County Health Department for their subcontract for May for the Cancer Services Program. We paid Finger Lakes Business Service for answering service. And that went through COVID, our COVID PHP grant, because most of it is now COVID-related calls. We refunded $300 to Ryan Walshak for wastewater treatment system inspection registration fee, $300. And we also paid American Commercial Cleaning Company $200 to clean the Auburn housing unit that we used for isolation and quarantine. We paid the regular vendors for EI and preschool. On the credit card, we paid $925 for 5 WIC staff to attend virtual trainings at $185 each. And we have used the language line for non-English speaking clients. And we purchased insulated farmers market bags for the WIC program for $1,900 through the WIC program. That's all I have. Does anyone have any questions?
Nope.
Yeah, it was under my 10 minutes. How about that?
That's terrific. Thank you. If nobody has any questions, does anybody want to move to accept the claims?
I will move.
Do we have a second?
Ron Digital, second.
Thank you. Very good. Tanya?
Hi. So a little WIC update. We did get approval from USDA and New York State Department of Health to continue remote appointments through September. So we're thinking we might start opening up about 50% capacity first. So right now everything is still being done over the phone. We did send out some letters to local healthcare providers just talking about how we're doing appointments and reminding them that it's really helpful that we get information like the weight, the height, blood work, so that we can do accurate nutrition assessments still, because that's a huge piece of WIC. So thank you. If anybody's on the call who's gotten one of those letters or who have helped us get that information over, we really appreciate it. Over the past month, we continue to see a lot of people remotely. Our show rate is still really good. We're seeing about 95% of people show for their appointments over the phone. starting to creep up a little bit. I think people might be getting sick of these remote appointments, but it's pretty good. We saw 656 appointments last month, which has been kind of a record over the past few months for us. Our participation, right now we've got 1,247 active participants on our caseload that we're seeing, which is pretty good. We also got, as Janine mentioned, we've got farmers market coupons being distributed now. So we started those June 1st. So far, we've given out 286 booklets, and those are people coming to pick up farmers market coupons curbside, so very low contact. We got 1,000 booklets to give out, but I think people are a little hesitant to come out and pick them up. But we think that those who are picking them up are going to be utilizing them, so we're really excited about that. And since everything is being done over the phone, that nutrition education piece with farmers market was kind of lacking. So Janine mentioned those nutrition ed farmers market bags, which are insulated. They've got some storage guidelines and shopping guidelines. There's a nice little shopping list. So that's sort of a supplement to our nutrition piece for farmers market. And then lastly, we're planning, well, it's coming up really soon. World Breastfeeding Week is the first week in August. Typically, we would host an event at Hoops Park. It would be our 6th year doing it. Every year we've seen additional families come to that. This year, unfortunately, we're not able to go to Hoops Park. Instead, we're going to be doing 2 virtual big latch-on meetings that our peer counselors and our breastfeeding coordinator are hosting. We've got, I think, about 20 girls signed up already who have breastfed this year, which is really exciting. We just want to celebrate them. We actually have a Wheel of Breastfeeding game, so that's going to be pretty fun. And then we also, just to sort of recognize breastfeeding in the community, we are going to have a banner hung across Genesee Street that says Cuyahoga County Health Department and the WIC program celebrate breastfeeding families in Cuyahoga County, which is pretty exciting. Even though we can't meet in person at the park, hopefully a lot of families will see that. And that's my update. Questions?
I had just a couple quick questions. Curious, the 1247, how close to that is the target you guys have set for participants? And did you say you were going to have remote till September, but you'll open 50% prior to September, or you'll wait till September to do that?
So answer to your first question, our target caseload is 1,500 a month. So we're at about 78% of that, which is pretty typical. That's where we've been. The next question was, so we won't be we'll be doing all remote appointments through September 30th. We're waiting on some further guidance for what to do next, but we're thinking it's going to be certain appointments only that we're going to be seeing in the office, which are required federally for us to see face-to-face. And that's about half of our appointments.
Thank you.
Yep.
Very good. Thank you so much, Tanya. Shall we move on to Eileen?
Hi. Okay, so let's start with consent orders. So there were 3 of them, and they all had to do with operation of a food service establishment without a permit. The first was Arby's in Auburn. The next one is Arby's in Weedsport. And then the third one was Gaetano's Pizzeria. So that's all I have for that.
This Keith, I move we accept the report.
Do we have a second? I'll make the motion to second. Any opposed? Okay, so we will accept the consent orders. Thank you, Eileen.
Septic Systems. So we just had our wastewater training class for the new people, and that's why that one person, because it was postponed from the end of early April that he wasn't able to make it. So we had the new class, and we also recertified the existing inspectors. So the septic letters are going out now to tell people that they're due, and the towns that are due this year are the towns of Montezuma, Ira, and Venice, and also Owasco Lakefront. And it's a shorter notice. Usually we would send these out, no later than mid-May, but people don't tend to do it until near the end anyway, so hopefully that won't be a problem. Harmful algal blooms, you probably saw in the paper that we had to close the bathing beach at the Y Camp due to a harmful algal bloom. And I have not heard of other blooms really throughout the lake. And it seems like in the past, the Y Camp seems to have them earlier than other places. I don't know why, but it does seem like we tend to close them earlier in the year. But Auburn, Owasco, and Wells College all have their carbon systems in operation, up and running, and also the operators at all three places are visually monitoring their raw water. They're filtering a raw water sample, and then they look at the filter under the microscope. And if they see anything, they will start sampling. But right now, we're not doing any sampling of the water going into the treatment plants or coming out of the treatment plants at those three water systems. We did send notices a while back to all people on Owasco, Cayuga, and Skaneateles Lake, remind them again about harmful algal blooms and how they should really never use the water for drinking right out of the lake, but especially they shouldn't shower with it or wash dishes with it if they have a harmful algal bloom in the area of their intake. We also are sending out information to all lakefront property owners since they're due for a septic system inspection this year. We thought we would throw in some information in the envelope about harmful algal blooms to remind them of that. Let's see, what else do I have? Okay, disinfection byproducts is an ongoing issue. So disinfection byproducts are chemicals that are created when organic material in the lake in surface water reacts with chlorine. So right now we have 5 systems who are in violation for disinfection byproducts. Montezuma, Aurelius number 3, Brutus East Water District, and the 2 districts in Fleming, the Consolidated District and the Fleming District 2 and Springport District 6. So we're hoping that this is based upon an annual running average, so they are required to sample quarterly, and they average, the most recent 4 quarters. So last August, everybody had really terrible numbers. So we're hoping that when they resample in August, that bad number will come off and they'll have a better number. But that is concerning. They have been in violation. I think this might be the 3rd quarter that these systems have been in violation with high levels of disinfection byproducts, which is of concern. How much more time do I have? Okay. Locus Meadows, I was hoping Rich would be on. I thought Rich Graham was going to be on this call and he could talk a little bit about where we are in Locus Meadows. The COVID thing put everything on hold. We do have someone who's very interested in buying the property, but he has not, for whatever reason, and I think they're legal reasons, and that's why Rich would have been good to explain. But he hasn't moved forward to actually purchasing the property. So, we've asked Rich to move forward to file the legal papers in order for us to get our money so that we can then, sell the property. So, because they've been kind of dragging their feet, but that's where we are on that. And it has been a problem because they do have an ongoing sewage violation, and of course the owner is not doing anything about that. Any questions on any of that before I move on?
So I guess I have a question about the byproducts of the combination of the chlorine with the organics. So typically, how is that removed from the process for the water?
Yeah, so one way it's removed, okay, so it's created by the length of time that the chlorine is in contact with the water. So the longer that the chlorine is in contact with the water, the more these chemicals are going to be created. So if they can flush their lines to remove old water, and they are required to take these samples at the worst possible place. So they take them where they're going to expect the worst results. So they take them at dead end areas where the water tends to be stagnant more often. So people generally in the area are probably not getting the water with those high levels, but those are the worst results that they probably have within the system. So that they can flush their systems, and a lot of them, water is expensive, and more expensive for some municipalities than others. And so to waste all that water is hard to swallow sometimes, but that's one way to do it. Another thing that they can do is they can aerate their water, and Montezuma installed a new water tank a couple years ago, and they included an aeration system in there, and that does help volatilize the chemicals somewhat. And also then the only other treatment that can be done is on the front end, which is Auburn. And Auburn's already doing a great job in terms of removing a lot of the organic material, but it's just, there's just a lot in the lake. And this is evidence of, the water quality declining over the years. Did that answer your question? A long answer for that?
I think it was a great answer, but
Yeah.
sorry.
Anything else?
One more thing.
Wait a minute, Eileen. He had another comment.
I was just going to ask.
Okay.
That's okay. Well,
I was
Go ahead.
also curious of what happens if they don't come into compliance.
Well, if they don't come into compliance, then the EPA will come down on them and tell them that they have to. So they will have to put in like the systems that don't have aeration, they will have to put in aeration, or they're going to have to waste the water. So that's really their only options at this point.
Their findings? Do you report their findings to the EPA? That's how they get involved?
Yeah, well, we have to report our findings onto the state's program, which is called CIDWIS, which is their software program, and the EPA has access to that. So they're able to see that, and they call them a SNCC. What does that stand for? Significant non-complier. So if they have so many, a certain length of time when you're out of compliance, then you become a SNCC, and then the EPA may become involved with that. Any other questions? Dr. Kosachov, did you have another one?
no, I'm all set. Thank you.
Okay. And then the last thing I wanted to talk about really briefly is prior to New York pause due to COVID, the legislature approved 2 positions for environmental health to replace 2 people who left. One left due to a retirement and one left due to more money, a better paying job. When COVID hit, the legislature understandably, took those positions back due to the uncertainty of tax revenues. We were able to hire a new sanitarian with a grant from the Emerson Foundation to deal with the increased lead load. As we discussed that last year, the state reduced the level where we would be involved with children's homes with elevated lead levels down to 5. So we were able to hire that new sanitarian for that. And, under COVID, with most things being closed off, our state opening up, COVID responsibilities are still a huge impact, and we're getting behind in our general work because we're down 2 people out of our office. And inspecting permitted facilities such as restaurants, campgrounds, mobile home parks, pools, water supplies, etc. Following up on failed septic systems and plan review for septic repairs and water systems. So anyway, I could go on. We're just having trouble keeping up at this point, and I foresee that we're going to get further and further behind. So we will be going to the legislature to ask for those positions again. And I'll have some data at that point to show, the impact better than just, our concern. So I just wanted to make the board aware of that situation, that we are getting behind in areas, and I don't like being behind, so it's kind of a concern to myself.
Eileen, I've got a question regarding.
Any questions on?
I'm sorry, can you hear me?
Yes.
I've got a question concerning the Y camp. My understanding is that they also draw water from the lake. Am I right?
No, not this year. They had in the past, and when they did draw water from the lake, and there was a harmful algal bloom, they would have to stop that and then get water from a bulk water hauler. But they've had so much problems, as you know, with the water system over the years, that this year, and I'm so appreciative that they took the step, they are bringing in bulk water and filling in their water tanks. So they are using municipal water for the camp at this point.
Well, that's great. So that my question is moot then, because I was concerned not only for the kids swimming there, but also potentially being exposed to something in the water. So that's not a concern then.
Correct. Anything else? Because I think I went over by 2 minutes, I think.
That was great, Eileen. Thank you.
Okay, great. Thanks.
I'm sure Nancy doesn't have much to say, so it'll get caught up there.
I don't know.
Okay, so we'll move on to Kathleen.
Great. So hello, everyone. Nice to see your faces. It's everyone's shown up, which is great. We did have an opportunity. Rich wasn't able to join us, but Chris Palermo, our county attorney, was just able to log on. And just for the sake of others on who may not be able to see, as you know, Ralph Batista was able to log on, Keith Batman was able to log on, and Dr. Joya is on as well. So just to make that a full, flesh that out. Before I speak about the New York pause and the violations, I'll just pop over. I don't know, Chris, how much you might be able to share right now. I know Rich is kind of taking point on the Locust Meadow issues with selling the mobile home park. Eileen tried to give a little bit of an update for us.
Yeah, so we do have a very interested buyer, is my understanding, who I believe is willing to work with the county on addressing the violations and really, getting the place right. However, as is typically too often the case, there's been a real lack of communication between the attorneys. I know Rich has reached out several times to the potential buyer's attorney, and we're not getting rapid response. And we're at that point now, I think, and I'd like Rich to confirm this for me, but my sense is that we need to start pushing the issue a little bit to give them some motivation. But that's kind of where we are today. So I don't know if that helps.
Thanks, Rich. So on to another topic, enforcement. So as you are all aware, there is face covering requirements in public places, such as stores and restaurants, churches, etc. There is also still mass gathering restrictions. So as a public health department, every single day, we get calls, emails, FaceTime, instant messaging, etc., with concerns, complaints, questions. We've had lots and lots of questions about interpretations of guidelines, but with these two particular issues, they're the top two for complaints and concerns of violations that are occurring. So when it comes to food service and permitted facilities, it's kind of a slam dunk. We're able to relatively easily address those in our typical process as far as making a visit, providing the education, and then a citation if appropriate. We are keeping a tally and putting a spreadsheet together. It doesn't take into effect the numbers of phone calls that we have had over the last many weeks. But kind of just went back to the beginning of July, even though it's been much more than that. And we're trying to keep a spreadsheet of the enforcement places and questions and issues that have come to our attention, how we get that information, what we do with it, and the follow-up that occurs. So this way it'll help us track repeat issues. So related to that is the question of how are we going to do enforcement? Because as all of you listen, when you have to the governor, he's saying the enforcement is on the local level. So we've had some conversations, and Chris Palermo's been part of this, and he'll be able to elaborate a little further. But there's, whether it's a lack of time, whether it's a lack of interest, I'm not entirely certain, but from a criminal point of view, there doesn't appear to be a lot of activity looking to pursue things in that way. So then we're looking to pursue enforcement in a civil manner, which would be through our Board of Health. So in talking with a group of people, we had our county attorneys, we had city attorneys, we had county and city representatives, we had our DA, we had sheriff department representatives. City police wasn't able to get on the call most recently. We've had a couple calls, but they've been very active. We had some conversations about how we might pursue this. So currently what we've been doing is asking people who call or email to call the New York Pause line, which is the 1-833 number. And we're doing that very specifically to have an official record of the complaints that are going on. And when a New York Pause call occurs, typically it goes up to Albany. Albany gets the specifics and sends it down to the local entities who are considered the follow-up agencies, which in our case it's the county sheriff department and it's the city police. So we've been getting a lot of their follow-up is being shared with us primarily for the non-food service type things, although there's like after hours, there might be some bars that get called. And so people call into the 833 number. And that's been helpful to see what type of follow-up, what type of education they are providing. But again, we don't always see it from the county side, but we know that they have to do that as well. But the city police chief is sharing every report with me. So we had discussion how we're going to pursue enforcement because number one, it's the county's obligation, right? That's being said, local government's obligation. But to be very frank, we're tired of it. We don't want to deal with the nonsense anymore of people who are flagrantly violating what the current guidance is, whether they agree with it or not. Is not necessarily the issue, although we certainly try in our education to explain the point of view and such. But we are getting kind of some outrageous comments. You know, there's one business who said to the police, no, I'd rather close down than use face covers. We have another business who said, no, I'm absolutely not going to ask my employees to wear face covers. We had another report of a 150-person wedding that was held over the weekend because they couldn't hold it in a public place. But we have to be able to take some sort of action on those that come to our attention because it really, not only is it kind of it's a frustration for all the work that we are doing and have been doing, but it also, unless there's a consequence, people are going to keep doing it, and it really usurps the authority that is being asked of public health. And in my opinion, we need to show a strong hand in that regard, that we're not going to allow flagrant violations. So as part of that, we talked about having talking with all of you and having some sort of an appearance document to be able to share with violators. I guess, Chris, this might be a good time for you to hop on to speak a little bit. There was kind of a draft order that Rich Graham put together.
Right.
but I'll kind of go back before we get to the order. There has to be an appearance. So Chris, I guess I'll have you speak if you don't mind.
Well, so I think the 10,000 foot view would look something like a complaint comes into the health department. Kathleen, you're probably all familiar with the grocery store that you have some problems with. So let's say it's a grocery store. Somebody from the health department would kind of come out, take a look, get the facts, observe the violations firsthand, come back, prepare basically what you'd consider a supporting deposition if it was a criminal case or an affidavit here in the civil side. Prepare that, sign it. We could attach a summons directing the person to appear before a hearing officer designated by the Board of Health, who would then, take testimony from both sides, make a recommendation, and that recommendation would then come to the Board of Health for approval. Be it result in a civil fine, most likely. In the event the respondent didn't pay, then we have to file a proceeding in county court to enforce that, similar to a judgment, how you would enforce any civil judgment. That's kind of the direct path for violations. Then we talked about, as an aside to that process, a consent order. So starting at the same place, the complaint comes in, the health workers go out, they see the violation, in which case there could be an order prepared, basically saying that, hey, you agree that you've committed these violations. Here would be the penalty, either perhaps some reduced amount or a high amount that's suspended temporarily. In the event you comply going forward after a period of time, this is satisfied. Either the suspension goes away with the original fine, or you've paid the minimal fine. And they also agree that in the event there's another violation, they waive their right to a hearing and consent to a more substantial penalty. I mean, that's kind of where we are at the moment. So run through the health department or the Board of Health, just like other violations do. For example, your septic violators. That's kind of how it would go. We still would like to rely on, probably the sheriff's civil division, even though the health department workers may go out and document the violation. Probably not a good idea to have them going out and serving the summons and complaint to the either the business owner or the property owner, depending on what the case might be.
Chris, I just quickly. So the citation goes to the business owner, even if the business owner asks the person to wear a mask, because that's the call I got yesterday, that there's just business owners are attempting to enforce and people are just downright awful about it.
Yeah.
I won't. It's my right. It's my First Amendment right. You can't make me. I'll never come back here again. So businesses the call I took was looking for help from the health department to at least do some public notice about, don't blame the business owner. They're just trying to do the right thing. It's just an awful situation.
Yeah, if that were the case, I guess there'd be an assumption that the worker from the health department would have discretion. Just because somebody's not wearing a mask in your store doesn't mean you're guilty of a violation of an executive order. Frankly, if somebody comes into your store, no different if they're not wearing a shirt or shoes, and you tell them to leave and they don't, well, then that's criminal. That's trespass. I mean, that's when you should call the police and say, I've asked this person to leave. They're not abiding by the rules to come into the retail outlet or whatever it is. And same as if you had somebody in a restaurant just shooting off vulgarities all the time. You call the police. That's the answer for the business owner. They probably shouldn't be looking at the health department for that. But also, I don't think we'd be citing them under those facts.
It's just the business owner's put in a terrible position. They're only trying to enforce the regulation, right? Not strip people of their civil liberties.
Right. And that's their job. I mean, so if they've got, but I think that at a point, if you walk into a store and nobody's wearing a mask, none of the customers are wearing them, and you find out that none of them were asked to, we saw the sign, but nobody else was, and nobody said anything, then it kind of, that burden sort of shifts over to the business owner. But, when it's the one ne'er-do-well that is going to exercise his those civil liberties, you can't make me do this. That's a different matter, I think.
are there any other questions that the board has? I mean, this is something that we want to, we've already started, like I said, from the restaurant point of view and food service, for keeping that track.
Do you have enough hearing officers to do it?
We have one, and we might, I don't know that we'll need that many, to be honest. If we can set an example, I think that's going to reverberate. And frankly, I would rather go right to the ones that have been a thorn in our side right from the start. Boom. Now peg them off right off with a citation and see the noise they make.
So from our standpoint, it would be similar to like getting the hearing and consent order that so-and-so's food was stored at the wrong thing and they received written notice and paid a $50 fine. And it would be the same sort of thing that we do for the restaurants already.
Likely, and Chris, you can speak to this, but honestly, there's not a lack of education among business owners. I'm not entirely sympathetic that if they're not doing what they're supposed to, I'd like to see more than $50 or $100. I'd like to see a real slap on the hand that's going to hurt a little bit. And for anyone, and I don't even just mean the business owners, for whoever it falls to, I'd like to see $500. We can go up to $2,000 if there's repeated violations. Now that's going to be your decision once something comes to mind. And so we have one hearing officer currently. We have had a backup hearing officer that we put on the books, and I guess we'll see how that goes. I think it's going to be the delivery of this, right? We may need. We can go with our staff to an extent, but I think this is where we need some further discussion with our law enforcement, because there may be situations that are absolutely not appropriate for us as health department staff to be moving forward in, right? There really should be law enforcement involved to deliver some of the message on some of this, because it's a violation of the law. It's not just health code.
Yeah, this is Keith. Could I ask a couple questions? Can you hear me? Never know.
We can hear you, Keith.
Great,
Yep.
Thank you. Okay, the first thing I want to say is in response to that last thing, I am very reluctant to get law enforcement involved. Unless there's, as we were talking about before, there's some issue that requires there's a danger, or it's so hostile or so on. Once you start enforcing the law, then all kinds of other things kick in, which become the potentially more problematic. I like the approach of a consent order, quite frankly. I think it's the kind of the lowest level of enforcement that we can do in terms of kind of containment. I think it makes sense. My question with that is and I don't know the answer to this, is the consent order process self-funding? So if we do have a process in which we assess a fine of, as you said, Kathleen, $500, is that $500 then available to pay the consent, the hearing officer, and to pay someone to go out and actually do the inspection, or does that just go into the general fund? Does anyone know the answer to that?
Janine, you could speak to that, where our consent order money goes to. I think there is a revenue line for the county health department.
Revenue line for environmental health, because they collect all the fees and stuff for that. So I don't know if you would put it in like set up a separate account maybe for COVID violations. I don't know.
No, probably not.
Okay. Yeah, if that's the way consent works, then that just goes eventually to the general fund. And I do think I'm pretty sure the legislature could establish a separate process for this, and I think that would be important, because the health department staff does not have the time or I think suspect the psychic energy to add one more enforcement process. I mean, it's great if they can, but I think that they would also be really good, at least to begin the process of setting up a fund just for COVID, where any fines that are collected go into a self-supporting fund, so that we can pay to get additional people if necessary and as necessary to do the inspections and then the hearing. But I think the approach is really good because it makes sense, you know. And the only other thing I would add is people can argue that like with food service, New York's food service requirements are a whole lot more stringent than many states, and people can argue that this requirement for a restaurant or that requirement for a restaurant is overkill, right? You can argue that because you can point to many other states where it's necessary, not required. That's not what we're talking about here. What we're talking about here is New York State. We have requirements, we have laws, we have orders that have been put in place to protect the public. We either enforce them or we don't, and it should not be our choice of what we enforce and what we don't. So I think it's our responsibility to enforce it. We just have to find a way that doesn't overburden our staff and doesn't create problems, budget problems, that then something else has to be cut within the health department to pay for it. So that's my 2 cents.
This is Ralph. I agree with what Keith just said. I think that's really wise to look at the revenue stream and make sure that this is going to be funded. But what I wanted to say is that I really believe I'm fully in support of this. I think if there are no teeth to the regulations, and essentially it's just a voluntary commitment, both on the part of the public and the part of the business owners, I believe that this is going to take a lot of the onus off of the business owners. That right now they've been put on the front line of having to enforce this, and who wants to do that? Nobody wants to be that police officer. And I think it's been stated that if this were another situation, a public disturbance, someone acting in a inappropriate, illegal way, you would just let the police handle it. So, but I do agree. If you don't want to make it seem like it's just coming down with a hammer, but certainly putting some teeth into it, I think it's absolutely going to help everybody, and especially the business owners, to say that we're following the law, and everybody needs to do that. And if you can't, then there's a process for that.
And if this goes forward, is there a way that you could put some public notice out saying, just to kind of put it on record, that this is a requirement of everyone who runs a business? They need to enforce this because now this business owner is going to be held accountable by this process. And it might, at least put the notice out there that, kind of get off their backs.
So we've kind of soft pedaled that with one of our updates saying that this will be enforced, but we didn't get particular about how it will be enforced. When we sent out our Friday, maybe last Friday, or maybe it was the Tuesday prior or the Monday prior, I don't recall. But yes, certainly the newspaper is we're more than happy. Yeah. Forewarned, forearmed, this stuff's going to happen, and don't shoot the messenger. The businesses are doing what they're supposed to do.
Great.
So how do you sort of envision this working? Does the business owner who has a client come into the store not wearing a mask, do they turn around and say, you don't wear a mask, you need to leave, and then the person doesn't leave, and then who are they calling? The business owner? Is the business owner then calling the health department? Is somebody from the health department then rushing over to try and catch the violator, get a name, get something? But if they can't get anything, how do you enforce that? This is sort of where I think it gets a little gray, where law enforcement probably has some ability or they understand the law better than the average individual.
I would agree with you. So in the situation you just described, if the business owner will attest to the fact that they asked the patron to leave, then the police can come and say, you have to leave, patron. You've been asked by the owner of the business to leave, and otherwise it's trespassing. But your point, I realize, is how are we going to, and it's been reactive, right? So we have gotten Ed and Jean's grocery store is an example. We have gotten innumerable complaints, and the owner has said, I'm not going to make my staff wear their face covers. Okay. Well, we know that. So it's been reported to us. We can go make a visit at any point in time and lay eyes on it ourselves and say, are people wearing their face covers or aren't they? And then take action from that point.
Yeah, and if I may make one more addition, this is Keith. The I don't think that we are interested or should be interested in the one-off. You know, so that the person that comes into a store and the owner says masks are required here, and the person says I don't wear masks, and I will never come back here again. There's not going to be much we can do about this for the reasons of response and so on. And we don't want to put the business in a position where they have to get so aggressive that they create difficulties with their patrons. I think what we're after are two groups. One is the employer or the store that discourages or never requires masks, so that the I've been to places where the owner discourages the wearing of masks. No one in the store has masks on except no employees do, you know. And when those are the people we want to get at. Or the store where that it's lackadaisical, you know. So you go and I think Kathleen mentioned this. You go into the store and half the people don't have masks. Well, that's more of a problem. That's more of an issue than the owner saying, please put on a mask, and someone saying, I don't have to. So I think we need to be clear what we're doing here. We're not going to solve the problem of no one wearing, of you know, every single person wearing a mask. I think we can solve the problem of the store owners or whomever it is being uninterested in the mask wearing and just approaching it lackadaisically. So, you know, important to keep in mind, I think.
So this is Eileen. What I had hoped to get out of this discussion actually is what is the fine that the board would like if, you know, so because we're going to go through the consent order process. And then if they don't sign a consent order, go through the Board of Health hearing process. So if we're doing the consent order process first, what fine would the board feel comfortable with, you know, accepting when I bring them to you? Because they usually already pay by then. So what dollar amount are you guys comfortable with?
I'm in favor of soft pedaling this as much as possible because I'm afraid of the slippery slope of the health department turning it into another arm of the police agencies. I think that if somebody's right, if they go into a store and people aren't wearing a mask, they can turn around and walk out. I think this is going to end sometime. I sure hope so. I hate to put a huge system in place to start fining and violating people. I'm a lot more libertarian than a lot of my peers, and I think it's not our point. I mean, if we're band-aided to do something about it, then sure, I guess we have to do something, but a minimal consent order with plenty of warnings would be the way I'd want to play it, because I don't want to turn into a police force. So I would say a small fine would be the best.
I think using the model of the fines that we use for septic systems, I think would be a good model, you know, starting with something. I agree with Brian in that we shouldn't, you know, come down, you know, extremely hard right off the bat, but certainly having a graduated fine if there's repeat, that sort of thing. And I think the fines provided in those regulations for the septic systems, I think are a pretty good model. Maybe we should just follow those.
Yeah, I think we should start off slow and ramp it up if necessary. And with any luck, this will all end. I hate to get into a big police force thing. You know, it's not what the health department is really for, is to start going into businesses and threatening them with closure and huge fines. And then we get into threats on our staff and people get angry at one another. And I just don't like to go there. I think we should minimalize it and let things settle out. I mean, this has been going on for 4 months already. It was supposed to be 2 weeks. And, you know, if this goes on for the rest of eternity, I don't know what we're going to do as a country, honestly. I mean, this has got to die out at some point, whether it's a vaccine or whether it's politics. But at some point, this has got to die out. I just have a hard time thinking that America's going to have to wear masks all the time and tattle on each other for not doing so. So I'm in favor of doing what we have to do by law, but keep it simple, keep it minimal, keep it scalable up, not overload our health department with this kind of stuff. This is enforcement that is another, you know, that could be just a nightmare. You know, it's bad enough we got to do septic tanks. There are only so many septic tanks, but there are a hell of a lot of people. And if they all decide not to wear masks, and we got to chase them all around, it'll overtax the health department and it'll turn us into another arm of a police agency. And I don't think that that's what we should be doing.
I just want to make a quick response to Brian. You know, I understand how he feels, but we as a health department or the Board of Health and helping to guide the health department policy have to understand what the health department is all about. And it's here to guarantee and ensure, you know, the health of the public.
Agreed. However,
what we're doing is following scientific and proven guidelines. I don't think anything that the health department or that's been done in New York State has been outside of the realm of science. So I don't, you know, if we continue to do that, which will lead to hopefully a quick solution and certainly helping to keep us safe in the meantime.
No argument.
That's perfectly reasonable.
No argument. I said in my diatribe here that we have to follow what we're mandated to do. So let's not get into the whether it's a good idea or not, because I think a lot of this is not proven, really, beyond a shadow of a doubt. But that's a different argument. If we are mandated as a branch of government to do something about it, we can do something. All I'm saying is let's not start with a big program. We should start with a small program and see how things progress, see how other people handle it. You know, and that's my opinion on it. I don't want to start with $2,000 fines for somebody struggling to keep their store open and people come in without a mask and somebody blows a hotline and the poor guy that owns the store is now subject to these huge fines. I don't think that's good for the country. And I think we just need to do what we're required to do and keep it on the low side. Because the original question is what kind of fine should we put on a consent order? And my answer to that is on the low side.
So all of you heard my opinion, and a large part of that is fueled by my frustration, as you can imagine. We're certainly open to anything. Consent orders, a lot of times have been $100, and you guys can see that, you know, $50, $100, and then repeat violations go up from there. Like I said, I think, and maybe I'm being a little Pollyanna on this, but I think if we show that we're going to enforce some things, do it a few times, and I entirely agree, we don't want to become an enforcement agency. There are agencies paid to do that. But I am all in favor of whatever you guys decide as far as a consent order amount, and then anything that goes beyond a consent order amount clearly is going to come before all of you to look at all the circumstances and make a determination based on what the hearing officer recommendation is, and it can go as high or as low as you want at that point.
I think what we start with is really honestly a moot point, because with the people that are it sounds like with the entity that you're describing, they're going to continue to have repeat violations. We'll ultimately get to the point where we end up with another mobile park where the person is trying and they're trying to collect the money. Whether we start big or start small and then go big, that's where we're going to end up, because that's where they want to take it. And I think we look better if we start small and try to show how reasonable we've been and how hard we tried to work with them and still ended up here. I think that'll play out better. So I agree with Brian for one.
Yay.
Do you think this will end up the way the other Board of Health consent orders go, where it gets published in the paper?
Yeah,
And so
sure.
then will be their first violation and second violation and fifth violation and
Yeah, I would expect it to get published, yes.
Well, what is
So-
the dollar amount then that people are suggesting? Because I think that's what the Eileen and Kathleen are asking for. It's not helpful to say start small, start low. What are people thinking? What's the proposal?
What's
I
the
I would
lowest
say
we
start with
usually do?
$50 and then double it.
50. I think 50.
I'm sorry. I was going to say we could use the same scale that's used for the septic tanks. I'd be perfectly okay with that.
I think
I would
it's
agree with that
$30 a
statement.
violation. Sorry, Tim.
What is
I'm
that
sorry.
scale?
And I tend to go with those that are on the front line and listening to Kathleen early on about her frustration and with all the events happening out there. I want to use her experience to go forward, and she wants some teeth in it. So at some level, it has to be something that's going to have teeth in it, or else it's ineffective. The workload on the health department is going to be the same whether it's got a $5 fine or a $500 fine, really.
aren't the hearing and consent orders, we'll fine you $1,000, but we'll write off everything except 100 if you agree to proceed with our recommendations? Yeah, we just do the same thing, and then if they don't agree to proceed, that's on them. They made the choice.
Correct. I'll defer to you, Eileen, but that's
Well, that's really for,
the process. Yeah.
so that's when the hearing officer will say, you know, that you have $1,000 fine because you didn't do your septic inspection. And if you do it within the next 30 days, that is reduced to 100. That really doesn't work in a consent order. The consent order is, okay, you're in violation. And then the next violation would be a new consent order unless we go to a Board of Health hearing. And the Board of Health hearing, of course, is a lot more time consuming on our end than a consent order. We typically use consent orders a lot for food violations, restaurant violations, and in almost all cases, the people accept the consent order rather than coming to a Board of Health hearing.
I guess I
Kathleen.
didn't understand that.
Kathleen, what's acceptable to you?
I'm fine with following what the process that we currently have in mind, which for the consent orders tends to be $50 per violation. But if there's a repeat, I don't want to do second consent orders. I'm going to go straight to Board of Health hearing, and then I want them to get slammed because I'm tired of it.
I'm okay
So-
with that.
Would somebody like to make a motion? Do we need a motion for this?
I motion.
Well, wait, before we make a motion.
Go ahead, Keith.
Oh, okay. Well, I could have spoken on the motion. Why don't we give the hearing officer a little bit of discretion to say to go with the $500 or $1,000, whatever the amount is, the up to that at the discretion of the hearing officer, because I can imagine cases where someone comes in and they say, "Here's the $50. Screw you. I'm not." I mean, I just know some people will do that, and so we're just setting ourselves up for, conflict. That's what we do with all the other stuff. If someone gives intent to fix their septic system, then the hearing officer says, "Okay, $50 or $100, whatever it is." And I like that little bit of discretion if people are comfortable with that. But if not, that's fine too. I'll make that clear.
How about including an agreement, like with the septic, the individual or business agreeing that they were in violation and that they would not do this again, and then that would be followed with a much tougher penalty if they did not follow up on their agreement. How does that sound?
That sounds good to me.
That
Yeah.
sounds good to me too.
I'm okay with that. And keeping it in the same format might make it easy because we're all used to that format.
Anybody else have any other thoughts?
Thank you. As you can tell, we're just beyond with some of it. So it's very helpful to know that we're going to be taking some enforcement action.
Very good. So what do you need from us? Do you need a motion then or no?
We're good. You're aware, you've identified the process as far as consent orders that is acceptable to you. That will help us when we have to move forward.
Great, thank you.
Thank you.
Just the last question. Who's going to serve this, Kathleen, in your mind? Your staff initially, and then you'll branch out to a peace officer or something? I mean,
We're gonna have to play it by ear. So some of the stuff, it might start with our staff. And if we need to move beyond that, we will. And I guess that's where we'd have to come back and have discussion about additionally with our law enforcement, which we understand, typically that they're there for criminal things. Do we talk about a peace officer? Do we, there's all sorts of additional options. So we'll see what the next few weeks bring us and I'll have a better idea to come back to you with if there's issues.
okay, thanks.
Anything else, Kathleen?
I could talk all day, but I'll stop now. Thanks.
Okay, then we'll move on to Nancy. Thanks. Were you guys able to hear me?
Nancy, I can see you. I can see the sign language, but I can't hear you yet.
Nancy's got to unmute. It shows her muted.
There we go, Nancy. Can you do it?
I'm struggling with this.
You're on, or you were on. If you want to come to my office, you can.
I will. You know what? It just will not allow me. So I'm coming.
So do you want to do Dr. Joya's report for a minute, Dr. Kosacha?
Okay, let's do Dr. Joya.
Thank you. Who's on now?
Okay, Nancy's ready to report.
Who's where?
Oh, there's Dr. Joya.
Hello, can everyone hear me?
Yes.
Oh, great. Okay. A few remarks that I've prepared, and I think maybe, and you'll be the deciders whether you think this is timely or not. But in a spring issue, it was either March or April, an article entitled "The Discomfort You're Feeling is Grief" was printed in the Harvard Business Review magazine. I shared with colleagues at that time as I thought it conveyed and it labeled the feeling felt universally throughout this community, state, nation, and world. All of us are feeling a number of different griefs. Loss of a loved one, loss of job, of money, loss of life experience, school, travel, playing a sport, family celebration, loss of a known and successful business model, loss of safety, and grief when imagining our futures. I intend to briefly share an example of our daily interactions with our community members in relation to COVID. But first, I ask that all of you do a check-in with self to determine what stage of grief you are currently experiencing. Not to be disclosed, but a check-in of yourself. There's no right or wrong. It is merely where we are individually. We will fluctuate between stages, and there's no right pattern or way to move through the stages. Denial. We're either avoiding, we're confused, we're shocked, or we're fearful. We're angered, we're frustrated, we're irritated, we feel anxiety. Oh, we may be bargaining. We're seeking a perceived sense of control over something that feels out of control. And we've talked of some examples in this last conversation that we had of people trying to take control when things seem out of control. Making decisions for self that may be contrary to what we need to do as a community. Depression, we either feel helpless, we are hostile, or we're overwhelmed. And then finally, at some point, we will accept and we begin exploring our options and our choices. So checking in with self. So I'll give you an example. And this is not a grandiose example. This is kind of typical of what we've experienced. We had a Syracuse health professional living within Cuyahoga County was identified as a contact, having visited her mother, who became positive. Our contact investigation and tracing was initiated. It was initiated actually in a different county, and then we pursued it with our persons that lived here. The healthcare professional denied having any contact other than with immediate family. She used PPE in her work setting. We followed up with the employer because this person did become positive. This person did become positive, so it did require us to follow up with the employer, and no further contacts within the work environment. Following up, with this individual, the index now, she had no contact other than her family members. But when word got out within the next 48 hours, there were friends that called in and stated that they had been in contact during the preceding beautiful first spring weekend, the first weekend of May. As a result, and one of those friends was a recent cancer survivor, so we got that going. Over 7 weeks, this case involved 16 people that we were following just in this county, with outbreaks in the family, within the family unit, who then a significant other gave it to another member in his work that was a significant business in the Northeast. And so there was impact within that business. There was the cancer survivor became positive. We had multiple persons within this case. We involved the police. We involved the county attorney to help us navigate in dealing with the index and her family. We had to intervene that way to try to make some inroads and try to put some controls around the situation. And in thinking of this story, we can suspect varying levels of grief experienced by this family and their friends, without a doubt. And our approach has consistently been that we must remain accessible. We're available 24/7, all hours for any community person to call with questions, including anybody within this family, which we did receive. We need to provide emotional support, and we must have a ton of patience as they're just dealing with this news. I have not talked to a person becoming positive that wasn't surprised. They're kind of surprised and kind of overwhelmed and wondering what their future is going to be like, and this existed here too. We have to demonstrate great compassion and emotional support. And even when we showed up with the police, because this person wasn't willing to even participate in conversation and us following, and we finally did make inroads on that whole situation. And hopefully, we also have to be responsible for informing and guiding and giving direction And when it gets out of control, we have to step it up and we have to be more direct. Every conversation that comes into this department or that goes out involves with a person that is experiencing some grief. And in my entire career, I think I've been exposed to a lot of grief, but never in the amount that everybody universally is experiencing. And when it comes to our healthcare workers and our police and firefighters, and just thinking about the unease with the police officers having to be involved, and I've talked to them personally, involved in any kind of enforcing, they are also experiencing stages of grief. So it certainly is a crisis. And as it was said earlier by Dr. Brunage, there will be an end to this. There is a beginning and an end to every crisis, but we have to find our way through. So that is my little, did I stay within 10? I think so. Any questions for me?
It sounds like you guys have a much more difficult job than I could have ever imagined. I mean, you guys are incredible.
Oh, it's mutual. Thank you.
Thank you, Nancy. Wonderful. Standpoint of a nitty-gritty sort of thing, I'd be interested in getting health department guidance as to if school does progress in regards to the models that they're discussing, at what standpoint do we have kids removed for 14 days, and how should community providers deal with the multiple phone calls that we're going to have from parents saying, my kid has was sent home from school with a 100.1, and when they got home they were 98.9 and they've been fine. Can you write me a letter to send them back to school?
I know you are. You know, I often say it at least 100 times a day. A new virus, new testing, new treatments, new guidance and regulation. Everything is brand new and it's evolving. It just requires such agility. So on that, and I had a couple conversations within the last 18 hours, is people's interpretation of the guidance. Now we're not surprised, right, of the confusion in that, and some people yielding to even stronger institution of policy than is required. And I encourage them not to do that, because we're trying to get people, bring them into the fold so we're all following what is required. And I think if we can get what is required, we don't need to do more.
I'll just add, if you can hear me all right. The school situation is a really hot topic, as you all well know, because the superintendent's interpretation is that a child goes home and cannot come back to school for 2 weeks unless they have a negative COVID test. And that's going to be a real hardship, because every elevated temperature and every symptom certainly is not COVID. That's a concern we brought forward to our State Department of Health, because the schools have directives from State Department of Health as well as from State Ed. And these are challenges that have not been ironed out yet, how that's going to be, how are things going to be realistically upheld?
Right.
And you're correct. Also, there's some question about you. And maybe, I think this is where I'm going to refer to my doctors as well as State Department of Health. We need to have the schools are looking to us for some standards by which they would close school, and for how long. So will it be a certain number of people who are ill? Will it be a certain number of people who are in quarantine?
again, every situation is so unique. And that's what I said to the superintendents. I don't want to make a blanket statement right now about what that will be. You have some indications that you follow when there's flu in a school. That certainly is something to go by. But we're really looking to gather a little bit more information. And I know it's hard because here it is the end of July, and in 4 weeks, kids are going to be ready to start school, right? 5 weeks, they'll be starting school. So there's a lot of discussion that still needs to be held, and understanding that we all need to be on the same page. You're absolutely right.
I have to take off, guys. Thank you very much.
Thanks, Cassie. Okay, anybody else have anything for Nancy or Kathleen?
We're good.
All right, thank you. We'll move on to Dr. Joya, if Dr. Joya is still here. Hello, Dr. Joya.
Yeah, hi. Yeah, I guess the question now, I guess, is just the kind of race between the vaccine and the lack of testing or testing capabilities. So it seems like by the time we get adequate testing, we'll probably have the vaccine already. But, we'll see. I mean, the first planning for the worst, just may have to go back and shut down if the schools get so bad and there's no testing. Essentially, it's going to be a functional shutdown. You can see how the in the major leagues, they've tried to go back, and then they've got cases, and then they've been canceling games because they got too many positives. So we're probably going to be in that instead of start and stopping. And I think things like Zoom meetings and doing work from home and video visits probably are going to be around until the vaccine is shown to be successful and we'll be okay. I guess that Paul Osterholm, the epidemiologist from Minnesota, is a great guy. He's kind of given up on contact tracing because there's just too much COVID, and he's think nobody's been able to do good contact tracing, except in a community like ours, where you can do it, small rural areas. But get to Syracuse, certainly New York City, it hasn't worked. So, but I think Nancy and Kathleen, we've done as good a job as anybody in the world. We've had limited cases, so we've been but if you get a bunch of cases, it's probably going to break down. The vaccines do look hopeful, and so far, no significant bad side effects have been publicized, and there's some antibodies responding, so should be okay. But that'll be a while. It's going to be, you're talking about 3 to 6 months before you get probably a significant vaccine effect. Then we'll have to worry about vaccine clinics. That's that'll be a problem, but it'll probably be easier to handle than trying to control all the cases.
Right. We're starting that next week. We're not doing the swabbing clinic because we're starting with vaccine clinics next week, and we have to elongate the scheduled appointment. We have to bring one person and one parent, one child in at a time. We're working through that, so we're going to run long days of vaccination clinics. We got to get them done. Those requirements have not changed, nor should they have.
The school-based.
Yeah, the school-based
vaccines.
So that's what we're going to be targeting next.
It'll be good preparation for the COVID vaccine clinics.
Right.
You're right, because the health departments will be tasked with that when there's a vaccine widely available.
Yeah. Sounds good. But plan for the worst, just in case.
Yeah.
Yeah, this is Keith. I have what I hope is a quick question and answer, and if not, then we can do it offline. But I've been asked, and I'm curious, why have we suspended the testing?
Oh, because of we've got to do vaccinations and for school, so we don't
Okay,
have the manpower.
gotcha.
The-
That's
the-
kind of what I thought.
Yeah,
I didn't want to assume that.
yeah.
Yeah,
the
because
testing
people can still get
is-
tests. We're just not doing it.
Also, the testing has produced uselessness because you don't get the results till the quarantine period's over.
It's
Correct.
terrible.
The incredible, it
Yeah,
just,
I have noticed that too. I've been.
It's right.
it's terrible,
Yeah.
the lag. And we are recommending to people, who call. Clearly, if there's an urgent need, they should go to urgent care, talk with their healthcare provider. If they're sick, they should be going to the ER. But if it's more routine or anticipated, I wonder if we're encouraging them to go to Syracuse and Ithaca to use their drive-through clinics, and their turnaround time. Ithaca's a little quicker because they do the analysis themselves in their own city. And Syracuse is trying to expand upon the number of smaller laboratories that may be able to help with analysis. So that's been a little bit.
Thanks.
Yeah, and you know what else? It absolutely requires us to be so agile with everything because we're not having it now doesn't mean that we won't enact that again. It's just the shifting priorities.
Right. No, I do understand that, Nancy. Thank you. Yeah. Yeah. Thanks.
Thank you, Dr. Joya. Anybody have any other thoughts or questions? Okay, so I'll entertain a motion to adjourn the meeting if there's nothing new.
Thank you all, and we'll definitely want to talk again in August.
Yes.
Very good
I
then.
move we adjourn this.
I'll second it, Daily.
Thank you, everybody.
Thank you.
Bye-bye.
Bye.